Schizophrenia is one of the most misunderstood mental health conditions in the world. Many people hear the word and immediately think of a split personality, but that is a myth. Schizophrenia does not mean having two different personalities. Instead, it is a condition that affects how the brain processes information, shaping thoughts, emotions, and perceptions of reality. People living with schizophrenia often experience three main types of symptoms: positive, negative, and cognitive. Positive symptoms are things added to a person's experience, like hallucinations, which are seeing or hearing things others cannot, and delusions, which are strong beliefs that don't match reality. Negative symptoms involve the loss of certain abilities, such as reduced motivation, withdrawal from social activities, or difficulty showing emotions. Cognitive symptoms affect how a person thinks and processes information, making it harder to focus, remember, or organize thoughts. The condition usually begins in late adolescence or early adulthood, often between the ages of 16 and 30. Its exact cause is still not fully known, but research points to a combination of genetic risk, chemical imbalances in the brain, and environmental stress factors. If a close family member has schizophrenia, the chances are higher, but it can also appear without any family history. Schizophrenia is not rare. It affects millions of people worldwide across every culture, background, and community. Yet despite this, stigma and misunderstanding remain some of the biggest challenges. Too often society labels people with schizophrenia as dangerous, unpredictable, or incapable. In truth, most people with this condition are not violent at all. They are far more likely to be isolated, misunderstood, and in need of compassion. Treatment makes a huge difference. Modern antipsychotic medications can reduce symptoms, and therapy can help people cope with stress, relationships, and daily challenges. But medication and therapy alone are not enough. Recovery also depends on support from family, friends, and communities that understand rather than judge. It is important to see the person, not just the illness. People with schizophrenia can study, work, create art, raise families, and lead meaningful lives. With proper care and encouragement, they can and do thrive. Breaking the stigma begins with knowledge. The more we learn about schizophrenia, the more we replace fear with empathy. And when we choose compassion, we create a society where mental health is respected, supported, and never ignored. People may experience hallucinations, delusions, and disorganized thinking patterns that make communication and daily life challenging. Schizophrenia usually appears in late adolescence or early adulthood. Research suggests genetics, brain chemistry, and environmental factors all play a role. Although it's a lifelong condition, treatment helps. Antipsychotic medication, therapy, and social support allow many to manage symptoms effectively. Schizophrenia doesn't define a person. With understanding, compassion, and proper treatment, recovery is possible and stigma can be broken. By learning about schizophrenia, we build a world where mental health is understood, accepted, and supported. Together, we can create positive change.